Well, I graduated from medical school in 1960, moved to Ogden and took an internship at the old D hospital. The McCady, of course, didn't exist at that time. And it was the end of my internship year that I heard about Ogden Surgical. I knew nothing about Ogden Surgical Society when I came here. But during my internship, it was mentioned several times, and I was invited to attend. And the first session I attended was in May of 1960. And I was 29 years old at that time.
And how did you hear about it?
Well, during the internship, several of the doctors, it was announced at the hospital during the internship, and the director of our intern training program is Dan Hunter, who was a member, and he mentioned it and invited all of the interns to come to the Surgical Society meetings, which were held at the old Orpheum Theater down on Washington Boulevard that year. So, in fact, they gave us time off from our internship to come down and attend the meetings. And I was very impressed by the meetings. Dr. Ernie Grua was a host of several visitors, and we attended at the Orpheum Theater, sitting in the old theater seats, and it was very, very interesting. They had many subjects which were interesting to young doctors in training, and so I very much enjoyed those meetings. And then they had a big dinner at the Hotel Ben Lomond in the ballroom right next door, which was a very, very exciting for us young interns. So it was very impressive for my first visit.
Good. So that was your, and what is your fondest memory of the conference?
Well, I have many memories. I think the fondest memory was the dinner, the program that night. But I was impressed by much of the information. A lot of it was very informative. I wish I could remember the names of people who spoke at that first meeting. I remember a surgeon introduced by Dr. Grua who gave us instruction in hernia repairs. And I remember being very interested at that. And many of the subjects presented were things that I was studying and learning, so they helped me become a better doctor.
Great. So did you, were you there when Dr. Ochsner?
Ochsner, yes, he was one of the speakers.
Okay. I think he was one of the speakers that came every year for a long.
Yeah, he was
for a long time.
Excellent lecturer and very interesting to listen to. So yes, I did remember Dr. Ochsner.
And what impact do you think the conference has had on the community?
Oh, I think it's had a major improvement in medical training and education over the years. It's been an outstanding information source for me, and I think for hundreds of others.
Okay. And then what impact did the conference have on your practice?
Well, it's a source of training. I've been every single year since 1960. I don't think I've missed one. And I've attended almost all the meetings at all of those things up until I retired. This last few years I've attended still every year, but I haven't made it every single meeting.
And do you have any pearls of wisdom for the younger physicians?
Well, I would counsel them to always go, because It's always interesting and informative and useful information presented. It was changed from the Ogden Surgical Society, the Ogden Surgical-Medical Society, which broadened the scope of the meetings and include medical information as well as surgical information. And it's always been vital information. I've had much information presented which has been extremely useful to me in my practice.
Okay, thank you. And do you have any pearls of wisdom on that you found from your practice or your years of medicine that you would like to pass on to the younger physicians?
Well,
like your work ethic or
they have a continuing medical education program, which of course is sponsored by the Ogden Surgical Society. And I think that ongoing training program is vital to continuing medical education. I think the updates of information that you learn after you graduate from medical school are probably most of the programs that help you to stay tuned up in the practice of medicine. And I've considered that information vital to my training and very, very helpful to properly maintain the proper knowledge and experience to practice medicine properly.
Great. That's wonderful. Thank you very much.
You're very, very welcome.
Is there anything else you'd like to add about the society?
Well, I think the society has been one of the brightest stars in continuing medical education, and very, very, very helpful in maintaining high standards in the practice of medicine.
Dr. Grua would come up and Jim McMurrin would come up on cases that we wanted. People didn't want to go to Ogden, they wanted to stay here if they could. And so the itinerant surgeons really helped our community, and when we would send patients down, I always went down, and I know Dr. Hannum did after he came here. And we would pick the surgeons that we wanted to scrub with, because we knew that some of them were better technicians and did better surgical work than others, and it wasn't long for us to find out who was who. And some of the busy ones didn't bother coming up here at all. And over a period of 10 or 15 years, going down there, scrubbing with them, we knew we could do just as good a surgery up here. And so Hannum and I did most of our surgery by the time we both retired.
What do you miss about the early years of the conference?
Probably just the small size. You got to learn and know who are members of the society, and you got to use them as referral physicians, and some of them would come up here and assist us with surgery on patients who didn't want to go down there for their surgery.
Okay. What do you wish you knew then that you know now?
Oh, wish I had a better brain. because I've forgotten an awful lot of what I've already learned. I tried to think of some things that I did and what kind of.
Did you have some interesting cases from your career?
Oh yes, yeah, I had some very interesting ones. One of them, actually, I was assisting Dr. Bunderson with one of his employees who had jaundice, and apparently it was obvious that she had a stone obstructing her common duct and was not getting the bile to go through, and it was backing up in the blood and out into the skin, and then made her jaundiced and quite ill. And he wanted me to help him, and he made the incision and got in and couldn't find where the stone was obstructing, and suddenly he says, "Ooh," he says, "I'm sick to my stomach." He says, I've got to break scrub and go out because I'm going to throw up if I don't." And I said, "Well, go ahead." And I says, "Elaine and I can take care of it." And so we opened the common duct and explored the common duct up the left and the right hepatic ducts, and we couldn't find any stones there. And following the common duct on down where it empties into the small intestine, I could palpate down there and I could feel a stone that was almost as big as a little tip of your finger, and it was palpable. And so we tried to the nurse and I tried to get it out with scoops, different scoops, and tried a Fogarty catheter, and we couldn't get it out. And so I said, well, the only way we can get it out is to open the duodenum, which is a portion of the small bowel where the bile dumps in along with a duct that comes from the pancreas. And so I opened the duodenum and found the stone impacted right against the valve, so there's no way it could get into the intestine, and it couldn't go the other way either. So with the cautery, I cut through the sphincter of Oddi, which is a sphincter there that opens and closes to allow bile to go into the intestine, and opened it large enough to just squeeze it through the enlargement that I made, and brought it out into my hand there inside the small bowel. And then I put some stitches back in it, and then I put a T-tube in it where we had opened the common duct further up closer to the liver. We put a T-tube in where we had a short limb of the rubber T-tube going up toward the liver, and then the long limb of the T-tube, we took it on down through the common duct and through the sphincter of Oddi down into the small intestine. After we had gone through the common duct with a Fogarty catheter and irrigated and made sure that we didn't have any stones still caught any place in the duct, and we had some gravel come out and just like sand. And after we had made sure that it was clear, then we let that long limb through the duct down into the duodenum, and then we close the duodenum, and then brought the long limb of the T-tube, brought it out through the skin and hooked it up to a bag to collect bile for a while. We didn't know just whether it was going to work or not, and we hoped it would, but we didn't get any bile, but the bile went right on through the tube and into the intestine, and we put a drain in, and then Dr. Bunderson took the drain and the T-tube out about 10 days later, and her jaundice went away, and she's doing well. I've seen her, and she's not had any trouble since.
Oh, wow. That's wonderful.
There was another one that was, I had a Japanese family in my practice, and his grandmother came from California to visit him, and when she was here, she got very ill and was throwing up and abdominal pain, and he called me, and I said, well, bring her into the emergency room and let me check her there. So we got x-rays on her, and had the radiologist who was living in Logan, he came over and he did our x-rays for us, and he looked at the x-rays and he said, well, she's obstructed. And he couldn't tell whether it was a large or a small bowel that was obstructing it, because she was upchucking all the time, and so I consulted with Dr. Bunderson, and he and I operated on her and found that she had a huge cancerous tumor in her mid-large bowel, which the bowel comes from the right side up and across this way, and then back down to the sigmoid colon and down to the rectum, and it was about as big as my fist, and it was obvious cancer, and she had cancerous metastasis all over her liver, and so we put our heads together, and I says, I don't like doing taking a tumor out of the large bowel and doing a primary closure, because usually you have to do a colostomy, and then they have to wear a bag. And that she was 80, early 80, and I said, well, I think what we can do is take the tumor out, because it's already spread to her liver, and she's not going to live very long with the tumor there, even if we take the obstructed one out. So we put a rubber drain around, made a hole through the omentum, both upstream and downstream of the tumor. Made a hole through the omentum and put a rubber drain through, and then cut a hole in the rubber drain and put the other through, and they pulled it up and stretched it, and then put a clamp across. But before we did that, we milked all of the contents of the colon down, and then we tightened up that, and it was like a purse string around it. And so we didn't have any fecal material per se in there that was we milked it so that it was empty both directions, and put this rubber. It's about the thickness of a rubber glove. It's in a tube, and we just put it around the bowel, and then tighten it up, and then put a clamp down, so it was acting like a tourniquet around the bowel above and below the tumor, and then we put rubber shod clamps where they take rubber tubing and put over the prongs of long clamps. They're longer than that, and then we milked everything out of the bowel that we could get out, and clamped across it with two clamps above and two below, and then we put a third clamp on, and then cut the tumor out, and the omentum of the blood supply that was coming to the tumor. We tied all of those off, and in the meantime we had taken lap sponges and put underneath the working area where we were working, all the way around and around the edge of the incision, and then when we cut the tumor off, then we irrigated it out with normal saline and Zephyrin solution, as I remember, and then we took, after we did that, sucked all of the fluid back out. Then we took all of the sponges out and changed our gloves and changed our instruments, and then took one of the clamps off that we had, the rubber shod clamp, so we would have enough tissue beyond the clamp to sew it back together. And then we hooked it back together with 3 layers of stitches, and it was just a day or two, and she was passing gas and eating tea and jello and broth, and she went home and stayed with her grandson for about a month, and then went back to California and to her doctor, and I sent a letter to him, what we found, and a copy of the pathology report, and he said he had never seen anybody do such a heroic thing as to take a tumor out of the large bowel and do a primary closure, because it was always a colostomy, and then he called me, I don't know, it was 5 or 6 years later, and to tell me that she had finally died in California. And so she lived about 5 or 6 years after we did the surgery on her.
That's wonderful.
Those two were, I'll die carrying those.
That's wonderful. How did you hear about the conference?
This conference?
Mm-hmm. When did you first hear about it? How did you hear about it?
Well, I went to the conference with Dr. Rasmussen in probably 57 or 58. And then I became a member and went to every year until I resigned here, I think, a year ago, and because I just wasn't able to go through all those, jump through all the loops to get there and get 10 seats in and then have to go to the bathroom.
But what is your fondest memory of the conference?
I think the fondest memory was meeting some of the original, some of the doctors that originally started it, who were friends with some of the older doctors in Ogden. And I can remember one named Oxner. And I can't remember the other names, but they always got nationwide surgeons, and then they started having medical speakers on medicine, and then they had little satellite meetings with the various specialties, ophthalmology and urology, and all of them. They would have one afternoon or one morning or something that they would break, and they've expanded that to days, and they've since the onset of the tools that they use now, they rarely open a belly to take out a gallbladder anymore. They all come out through a scope and do the surgery through that. And it's amazing how adept some of those surgeons get with it. We have one in Brigham who's extremely good, and after I retired from the office, I assisted at surgery from 1985 until 95. For 10 years, I assisted with the OBGYN docs and helped them do their cesarean sections, and orthopedic surgeons helped them on their herniated discs and total knees and total hips, and I even helped the ophthalmologist for a little while taking cataracts out, just holding the light right where they wanted it. And
Do you have any pearls of wisdom for the physicians at the conference and health providers that come?
No, I don't think so. That it's you can get a lot of training in your medical school and your after training, your internship and your residencies, but it seems like an awful lot of it you get from running into things that you haven't seen before or done before, and you figure out how to do it, and then you look it up and try and find out how to do it. Like I had a little girl one time with the rotary, when the rotary lawnmowers became fashionable. I had this little girl, they ran over a piece of barbed wire, I guess, and they cut it and threw it threw a little piece about that long, and it went right into her abdomen. They took her into the emergency room, and they tapped her, and her belly was full of blood, and so we opened it and found out that the little piece had hit and gone through the spleen. I think she was about 7, and I had never done a splenectomy, and although I was very familiar anatomically where the blood vessels were and what would have to be done. But so I had the operating room call my wife and to bring my surgical text down to the hospital. And they laid it on a table, and I went out in the hall and looked at it and just what we had to do to take her spleen out, and because she had losing a lot of blood, and of course I had put clamps on the vessels, that the arteries and the veins, while I was learning how to take it out. And took it out, and she got along fine, had no problems to my knowledge. So sometimes you learn on the spot what you have to do and ways to do it.
Is there anything else you'd like to add, Dr. Smith?
The only thing before Dr. Hannum came and joined me, he came in September of '59, and so from July of '56 to September '59, I think I had 1 or 2 days off, and so it's nice to have a partnership with someone that you can work with, and he hadn't had any training in surgery, and so I would teach him as much as I could, and he would go down to Ogden. We both went down to the old D hospital and assisted the surgeons with the surgery that we would send the patient down for, and we learned a lot from that. And so by the time I retired, we were doing pretty much most of our own surgery. It was nice. It was just nice to have a relationship with a friend like that, and he and I had gone through pre-med together and went to the same medical school, and he got he was given a fellowship in pathology. That meant he dropped out of the school curriculum for a year, and he was already 1 year behind me because I had 1 year of college before the war, but I was interested in being an architect then, and so when I changed my mind and decided to go to medical school, I started even though it was my second year in college, it was my first year in pre-med. And so he and I were in the same classes all through pre-med, and I went winter and summer to get through, because I had a little boy that was, let's see, he would have been 4 years old then, and so I had to get through as fast as I could. And after I finished anatomy, I was offered a fellowship to be an assistant in the anatomy department, and that I talked with my wife, and we decided that it would be best for me to just go on and not take the fellowship in anatomy, although I would like to have done it, because I loved anatomy, but I told the dean of anatomy that I had to get out and start making some money, because my wife was working, and I worked summers. I worked summers at Kodak film plant in Rochester, in the emulsion plant. And most of the students would go out there and would get a job, and they would put them in the lab measuring different chemicals in the manufacturing of the emulsion. And they asked me what I would like to do, and they said, "Do you want to go down and work in the chemistry lab?" And I says, "Do you have a carpenter shop?" And they said, "Yes." And he said, we never had anybody want to be in the carpenter shop. And they called down, and I said, "Yeah, we could use another hand down here." So every summer that I was there, I worked as a carpenter down in the carpenter shop. And we made engineered desks and things. And so I was getting about double the scale that they were, because I was getting paid like a carpenter, and we made a lot of plastic models where they could route the emulsion in stainless steel cans from one floor to another, and we figured out how they could run them down, and then they would just go back and forth down a little thing. They would take them this way, then this way, this way. You probably see how they do that with the vegetable cans in the grocery stores sometimes now. And we did, I think we made about 8 or 10 oak engineer desks they were about 8 feet long and about 3.5 feet wide. And then they had drawers along the front, and little drawer pulls that we made on the lathe. They had put battle shop linoleum on the top so they could unroll their big long plans, because Kodak was expanding them. And that was a fun thing for me, because I like building and designing, and that's why I like my house.
I graduated from Northwestern Medical School in 1953.
And what impact has the conference had on your practice?
Well, I'm an anesthesiologist, and so as far as the conference is concerned, I think probably the most impact it had on me is that it allowed me to know what was going on in the other specialties and the family practice areas of medicine rather than just anesthesiology.
What impact do you think the conference has had on the community?
Well, I believe it has a lot of influence. It was widely advertised in the Standard Examiner each time, and so that people in the community could understand what was going on with medicine at the time, up to date in the various medical fields. So, plus the fact that from the financial standpoint, it also brought more economy to the community.
What do you miss?
I miss my practice. I wish I were still practicing anesthesia. I love to do anesthesia for kids, and I have missed it since I've been retired.
What are some interesting cases from your career?
Oh, I think here again, probably just all my experiences with young children. I thoroughly enjoyed it. We used to bring the kids to the OR in a wagon, and I pretended it was a train, and I'd toot them into the OR and try to console them as much as I could so that there was not a bad experience for the children.
Do you have any pearls of wisdom for the younger doctors?
Yes, attend these meetings. They are valuable meetings, and you're missing out if you do not come to Ogden Surgical or Weber County Medical. they're very interesting meetings. You get the social life along with it, and you're missing part of your medical experience when you don't come to these meetings. So many of our meetings nowadays, if it weren't for the people my age, the retirees are the ones that are close to retirement, these societies may not even be able to continue because the younger generation does not seem to have the interest that they should.
What do you wish you knew now? What do you wish you knew then that you know now?
Oh, of course, anesthesia has so much progressed since I was doing practicing anesthesia. When I started out, I gave every single anesthetic that was ever given, from chloroform and ether, open drop, to all the other anesthetics. And it would have been nice to have all the availability of anesthetics that we have nowadays at the beginning of my practice.
How did you hear about the conference?
Just by word of mouth. When I first came to Ogden, after I finished my residency and came to Ogden, that was one of the first things that people were talking about. Be sure and go to the Ogden Surgical-Society meetings. They're very excellent meetings, and I started to go to them and enjoyed them, and have been going to them ever since. I still go to them.
What is your fondest memory of the conference?
Probably meeting some of the big names in surgery, like Alton Oxner from Charity in New Orleans, and some of the doctors from England and also from Sweden that came on the earlier meetings of the Ogden Surgical-Society, and probably those are the main things, and just the camaraderie of these meetings.
Is there anything you'd like to add about the conference?
Yes, to the younger generation, don't miss them. They're very valuable, and it gives you a total picture of the science of medicine and the various specialties in up-to-date practice. So it's very valuable, and you're missing out if you don't go to these meetings.
Dr. Hannum, what year did you graduate from medical school?
1955.
And what impact has the conference had on your practice? What impact did it have on your practice?
Well, there are several things that I can think of right off the bat that are significant for me. First and foremost, it's been the most convenient and comprehensive and simple way to continue to try to stay abreast of the ever burgeoning and increasing medical knowledge that develops on an exponential basis. And here it is, only 20 miles away. I've attended conferences in California, I've attended conferences in New York and Chicago, and places in between. And they've all been valuable to some extent, but none of them has the same flavor and the same broad spectrum that the one in Ogden has. So it's been my major source of continuing medical education.
What impact do you think the conference has had on the community?
That's a more difficult thing to say because living in Brigham City, it hasn't quite the same base of reference that it has for physicians that live in Weber County and in Ogden. But I would say, hopefully, that the impact that it has had on people in Brigham City is that it's kept physicians, it's enabled physicians to keep up with current trends in medicine, and consequently provide those advances and knowledge to the physicians who treat people here in Brigham.
Great. What do you miss about the early days of the conference?
Well, I think probably, like all old doctors, perhaps not like all, but to me the collegiality that existed 50 years ago has diminished significantly, and I believe that probably is a normal consequence of the fact that the conference has grown. It's gotten much larger, so there cannot be quite the intimacy that there was 50 years ago, or 40 years ago, or 30 years ago. But all in all, I think they've done a very good job. There is still a good deal of opportunity for socializing, especially for looking for colleagues whose minds you can pick with regard to specific questions that you as an individual practitioner have, or patients maybe that you have referred to the physicians in Ogden and you have an opportunity to talk to them about it directly. But it isn't a matter of missing it so much, it's just that it's a transition into a different type of interaction with the physicians there.
What do you wish you knew then that you know now?
What do I what?
What do you wish you knew then that you know now?
What do I wish I knew?
What do you wish you knew then that
Oh,
you
then?
know now?
Oh, I find that a difficult question to answer. I think as you go along in life, you can't know what you don't know. So, I think it has been a very good learning experience to attend the conference and to try to keep up on the current and progressive things knowledge that disseminates in medicine. So that's the way I would have to answer that.
Thank you. How did you hear about the conference?
Now that's kind of an interesting thing. My brother and Dr. Smith and I had all been in pre-medicine together at the University of Wyoming. And they were both ahead of me because they were a good deal older and had been in the war when I was too young to be in World War II. But we ended up going to pre-med together and actually graduating and looking for places to practice at approximately the same time, that is within a couple of years of one another. So my brother, who had gone to the University of Colorado and done an internship in Iowa, University of Iowa, had then come back to Ogden and done a surgical residency with Dr. Dean Tanner and other physicians on the staff, of course. And my brother was actually the one who told both Dr. Smith and me about the conference. He may have forgotten that, I don't know.
What is your fondest memory of the
Well,
conference?
there's too many fond memories, but obviously my fondest memories would go back to the people that I knew originally. Dr. Lou Peary, who was such a wonderful friend and mentor, he and his wife Kiki. Dr. Dean Tanner, who was always such a wonderful and knowledgeable person to consult. And very good friends, Boyd Farr and Basil Williams and Lou Snyder, and there were so many others that befriended me when I first came here. It's hard to get started on them. I'll forget some of them. I may jot it down. Lou, Paul Southwick, of course, and Basil Williams. Tony Lund was a very dear friend. Ernie Grew, Jim McMurran, Russ Nichols, Don D. Olson, Homer Rich, a wonderful character and a wonderful mentor and enthusiastic person, Lou Snyder, Floyd Seeger, Russ Hurst, Gail Keyes, Manly Utterback. These were all people who were unusually friendly and helpful to me and helped introduce me into the greater medical community. And I'm sure I have overlooked many of them, so I'll have to apologize for that. But that was a wonderful introduction into this community.
Do you have any pearls of wisdom for the physicians at the conference?
No.
No?
My only insight would be to urge